Hello and warm welcome to everyone. Today I am starting a new unit, that is pathology of the liver. So before going to the various lesions affecting liver, we should start with the basics. So liver is an organ that is present in the right hypochondrium at weighs around 1.4 to 1.6 kilograms. Regarding the blood supply, it has got dual blood supply. So two-thirds of the blood comes from the portal vein, which also supplies the nutrients along with it, while the hepatic artery supplies gives the one-third supply to the liver, and it has got the oxygenated blood with it. Regarding the liver architecture, so the liver tissue is composed of numerous lobules of hepatocytes. So the basic unit of the liver are the hepatic lobules. Now, regarding the function of liver, so it helps in the synthesis of the bile, which is important for the digestion of the fat. Then it causes the metabolism of drugs, fats, proteins, carbohydrates, and so it also is important for the detoxification in the body. Now, the liver tissue, I told you the basic unit is the hepatic lobule. So let's see how the hepatic lobule is formed. So this is the liver, and it is composed of these hexagonal lobules. So these are all the hepatic lobules. In each hepatic lobule, there are these plates of hepatocytes. These are the hepatocytes. If you talk about a single hepatocyte, it is a polygonal round cell with a central nucleus and lot of abundant granular cytoplasm, because it has got lot of organelles like mitochondria, endoplasmic reticulum, which is important for the metabolic function that it plays. So the cells, they have got abundant pink granular cytoplasm, and that is how we identify hepatocyte on the hematoxylin and eosin stain. So coming back to the lobule, so these are the plates of hepatocytes. Now these plates of hepatocytes, they are separated by sinusoids. So there are sinusoids in between these hepatocytes, and in the center of this lobule there is the central vein, and in the edges of these lobules we can see there is portal triad. So there are 6 portal triads surrounding a hepatic lobule. In a portal triad we have a portal vein, then hepatic artery and bile duct. So these three, they run in parallel to each other. About the flow of blood, so the flow of blood in the portal vein and the hepatic artery is from the peripheral to central, while in the bile duct the flow will be from the liver to this bile duct, because the hepatocytes are synthesizing the bile and then it will flow towards this bile duct. So getting into some more details, so this is the H&E section of a liver, and you can see this is the central vein. This is the central vein, and these are the hepatocytes. If we zoom into it, we can see a single hepatocyte. This is a single hepatocyte. It has got a central nucleus and then abundant pink cytoplasm. As I told you that they have pink abundant granular cytoplasm. So this is the appearance that you have to remember for the image based question. So how the hepatocyte looks. So these are these plates of hepatocytes, which are composed of these round polygonal cells. Again, you can see these are the plates of hepatocytes. This is a central vein, and this is the portal region, which has got the portal triad. Now here this is a picture from the Robbins. So this is the hepatic lobule. This is the hepatic lobule, and in the corners we have got this portal triad. Portal triad has got portal vein, then hepatic artery, and this bile duct. So these branches, they supply the blood to the liver. Now the portal veins and the hepatic artery, they branch, and then they pour their blood into the hepatic sinusoids, which are present in between the hepatic plates. In the hepatic sinusoids, the blood of the portal vein and the hepatic artery, it both mixes. So these are the hepatic plates composed of the hepatocytes, and in between these plates we can see this is the sinusoid. So in the sinusoid, the branches, the portal vein and hepatic artery, their branches, their blood mixes and then supplies the hepatocytes. When you talk about the flow of blood, it will be from the portal vein to the central vein. From the central vein, it will go further to the hepatic vein, from there to the inferior vena cava, and from there to the right part of the heart. So this is how the blood flow goes from the periportal area to the central area. So on the basis of this blood flow, we have divided the liver into different zones. So this is a hepatic lobule, and hepatic lobule is composed of various acini. These are called the hepatic acinus. This is the acinus. So in the acinus, the zone that is nearest to the blood supply, because the blood supply is coming from the portal triad going towards the central vein. So this zone has got the richest blood supply. This is called the periportal area and the zone 1. Then zone 2 is the mid-lobular area, and zone 3 is the area that is farthest from the blood supply, which is nearest to the portal vein. So this is the centrilobular area. So centrilobular, mid-lobular and periportal. So these three areas, these are given the different name of different zones. The importance of these zones is that the zone that is nearest to the blood supply, it is more prone to the injury by toxins, because toxins, they will be present in the blood, and the area getting the highest blood supply, it will be more prone to the injury by the toxins. Then the zone 2, it is more susceptible to certain viral infections like yellow fever. And the zone 3, which is farthest from the blood supply, it is most prone to the ischemic or hypoxic injury. So these are the important concepts regarding this division of zones in this hepatic acinus. Now next, the cellular arrangement in the hepatic lobule, that is again important for developing the concepts. So again, I told you that these are the hepatic lobules. These have got these plates of hepatocytes, and in between these plates of hepatocytes there are these sinusoids. So these sinusoids, they have got a fenestrated membrane, and in the sinusoid, the branches of the portal vein and the hepatic artery, the blood from both of them, they mix and they enter the sinusoid and move towards the central vein. So here this sinusoid, if we see the details, so this is a sinusoid, it is fenestrated, it has got gaps in between, and inside these sinusoids, they are also lined from the inside by these Kupffer cells. The Kupffer cells, they are nothing but they are macrophages. Their name is Kupffer cells. And the space that is present between the sinusoid and the hepatocyte, it is known as the space of Dis. This is the space of Dis, and this space of Dis, it houses these cells, which are known as the stellate cells or ito cells. The importance of these cells is that whenever liver gets some injury, these cells, they convert into myofibroblast and then they become fibrogenic. It means they lay down fibrous tissue or collagen. So this again we will study later when we read about cirrhosis. So you should know these cells, its location in the space of Dis, and what is their function. Another function of these ito cells is the storage of vitamin A. That is again important for the MCQs. And when I told you that Kupffer cells, which are lining the sinusoids, which are present in the lining of the sinusoid, these are nothing but these are macrophages. So sometimes a question is asked, which immunohistochemical marker will they exhibit? So that will be CD68, which is the same marker as for the macrophages. So again, this picture is again same I have taken from the internet, and in this picture again you see these are the hepatocytes. In between these hepatocytes, these are the bile canaliculi, because the hepatocytes, they have also called the function of synthesis of the bile. So then they secrete this bile through this bile canaliculi. These canaliculi, they are present in between the two hepatocytes. Now this is the sinusoid, it is fenestrated, these spaces, these are the fenestrations, and in the lining these Kupffer cells are also present. And this is the endothelial lining of the sinusoids. We know any vascular channel, it is lined by these endothelial cells. Additionally, the Kupffer cells are there. And now this space is between the hepatocyte and the endothelial cells. This is the space of Dis, and it has got these stellate cells or cells of I2. So this is the HND image. Again, in the PG entrance exam you get these images, so you should identify the hepatocytes polygonal cells and with abundant pink granular cytoplasm, central nucleus. So these are the hepatocytes, and these are the plates of hepatocytes like this, and in between the plates these are the sinusoids. You identify the sinusoids by their lining cells, which are elongated endothelial cells. Like here you see these elongated cells, endothelial cells, and the lumen of the sinusoid, it has got these RBCs. So, and this is the portal triad having the branches of the hepatic artery, bile duct, and this dilated portal vein. So this is the portal triad. Now again the revision of all that I told. So the significance of zone 1, which is nearest to the blood supply, is that it is most prone to the toxin damage, since it has got the highest blood supply. It is periportal. Zone 2 is a mid-lobular region susceptible to viral infections like yellow fever. Zone 3, it has got the least blood supply, so automatically it is most prone to ischemic damage. Stellate cells in the space of Dis, they are present. They store vitamin A and they also lay down collagen, so they have got fibrogenic action. Then Kupffer cells, they are nothing but macrophages, and they will show the ISC by CD68. In addition, the hepatocytes, the immunohistochemical marker for hepatocytes is HepAR1. Again, this you should remember for the MCQs. Now, liver has got a synthetic function. It synthesizes various proteins, clotting factors, and also synthesizes the bile. So, bile is composed of bile salts, bile acids, bile pigments, and that is synthesized by the liver. So, how the bile flows in the liver and reaches the second part of duodenum. In the liver, the hepatocytes, they are opposed to each other, and they secrete the bile into the bile canaliculi. So this bile canaliculi, it is present in between two hepatocytes, and the membrane here are opposed to each other. Here they will secrete the bile that is synthesized by the liver. From here it will go to the canal of Hering. It will lead to the bile ductules, and then it will lead to the interlobular bile ducts. These are the bile ducts that were present in the portal triad. So after that they will go into the right and left hepatic ducts. So from the various portal triads, the bile ducts of the portal triads, they pour the bile into the right and left hepatic duct, and the right and left hepatic duct, they will lead to the common hepatic duct. So this is the right hepatic duct, this is the left hepatic duct, and this is the common hepatic duct. Now the bile, after its synthesis, it is also stored in the gallbladder. The gallbladder, after the neck, it has got this cystic duct. So the cystic duct will combine with the common hepatic duct, and then it will form the common bile duct. So this is the common bile duct. It is formed from the cystic duct plus common hepatic duct. Now the CBD, it will go and combine with the pancreatic duct in the substance of the pancreas, and then when both of them will combine, they will open into the ampulla of Vater that is present in the second part of duodenum, guarded by the sphincter of Oddi. So this is how the bile flows. Now bile is composed of bile acids. So what are bile acids? They are primary and secondary bile acids. So primary bile acids, these are cholic acid and chenodeoxycholic acid, and they are conjugated by taurine and glycine, and then they are known as bile salts. So the conjugated bile acids, and sometimes they have sodium and potassium in it, so they are called bile salts. And then secondary bile acids, they are produced in the intestine, and they are deoxycholic acid and lithocholic acid. Again, these are important from the MCQs and Viva point of view. So at last, when we evaluate a liver disease, and then there are certain measurements we do in the serum. So in the liver hepatocytes, they have got certain enzymes, aspartate aminotransferase, serum alanine aminotransferase, serum lactate dehydrogenase. So when the liver cells get damaged, so their levels will increase in the serum. Now liver has got excretory function. It excretes the bile. Bile comes from the liver, and so there are again serum estimations that we do. We do serum bilirubin, then we do plasma membrane enzymes like serum alkaline phosphatase and gamma glutamyl transpeptidase. So these enzymes, they are present in liver cells as well as the bile duct epithelium. So they will be increased when there is damage to the biliary epithelium also. Then we can do the test for bile salts, bile pigments, bilirubin in the urine also. Then serum bile acids can also be done. Now liver has also got the synthetic action, so for that we can test serum albumin, coagulation factors, because they synthesize these components, so their level can be estimated in the serum. Now it synthesizes the coagulation factors, so we can also do estimation of prothrombin time, partial thromboplastin time. So these will also help us to estimate the function of the liver. Then for hepatic metabolism, we can estimate the ammonia levels in the serum. So this was all about the basics of the liver, anatomy, histology, and after that I will be starting with the bilirubin metabolism. So if any queries are there, you can post in the comment section. Thank you very much.